Hi, Chris Neal here again. Those of you that know me know that I'm a British psychologist and that I've lived and worked here in Madrid in Spain for the last 22 years. Today, I'd like to talk about the difference between a panic attack and an anxiety attack, which are things that some people confuse. You might hear people talking about panic attacks and anxiety attacks like they're the same thing, although really they are different conditions. Panic attacks come on suddenly and involve intense and often overwhelming fears. They're accompanied by frightening physical symptoms such as a racing heartbeat, shortness of breath, or nausea. The latest edition of the Diagnostic and Statistical Manual of Mental Disorders, the DSM-5 from the American Psychiatric Association, recognizes panic attacks and categorizes them as unexpected or expected. Unexpected panic attacks can occur without an obvious cause, whereas expected panic attacks are caused by external stressors such as phobias. Panic attacks can happen to anybody, but having more than one may be a sign of a panic disorder. Anxiety attacks aren't recognized in the DSM. The DSM-5 does, however, define anxiety as a feature of a number of common psychiatric disorders. Symptoms of anxiety include worry, distress, and fear. Anxiety is usually related to the anticipation of stressful situations, experience, or events, and it may come on gradually. The lack of diagnostic recognition of anxiety attacks mean that the signs and symptoms are open to interpretation. That is, a person may describe having an anxiety attack and have symptoms that another has never experienced, despite indicating that they too have had an anxiety attack. Panic and anxiety attacks may feel similar, and they share a lot of emotional and physical symptoms. You can experience both an anxiety and a panic attack at the same time. For instance, you might experience anxiety while worrying about a potential stressful situation, such as an important presentation at work. When the situation arrives, anxiety may culminate in a panic attack. It may be difficult to know whether what you experience is anxiety or a panic attack. Keep in mind the following. Anxiety is typically related to something that's perceived as stressful or threatening. Panic attacks aren't always cued by stressors. They most often occur out of the blue. Anxiety may be mild, moderate, or severe. For example, anxiety may be happening in the back of your mind as you go about your day-to-day activities. Panic attacks, on the other hand, mostly involve severe and disruptive symptoms, so they don't let you do anything else. During a panic attack, the body's autonomous fight or flight response takes over. Physical symptoms are often more intense than the symptoms of anxiety. While anxiety can build gradually, panic attacks usually come on abruptly and overwhelm us. Panic attacks typically trigger worries or fears relating to having another attack. This may have effect on your behavior, leading you to avoid places or situations where you think you might be at risk of a panic attack. Unexpected panic attacks have no clear external triggers. Expected panic attacks, on the other hand, along with anxiety, can be triggered by similar things. Some common triggers include a stressful job, driving, social situations, phobias, reminders or memories of traumatic experiences, chronic illnesses such as heart disease or diabetes, chronic pain, withdrawal from alcohol or drugs, caffeine, medication supplements and medication itself, and thyroid problems. Anxiety and panic attacks have similar risk factors. These include experiencing trauma or witnessing traumatic events either as a child or as an adult, Experiencing a stressful life experience, such as the death of a loved one or a divorce, experiencing ongoing stress and worries, such as work responsibilities, conflict in your family, or financial woes, living with a chronic health condition or life-threatening illness, having an anxiety personality or an anxious personality, having another mental disorder such as depression, having close family members who have also had anxiety or panic disorders, using drugs or alcohol. Doctors can't diagnose anxiety attacks, but they can diagnose anxiety symptoms, anxiety disorder, panic attacks, and panic disorders. Your doctor or psychiatrist will ask you about your symptoms and conduct tests to rule out other health conditions with similar symptoms, such as heart disease or thyroid problems. To get a diagnosis, your doctor may conduct a physical exam, blood tests, a heart test, or a psychological evaluation or questionnaire. You should speak to your doctor or a psychologist or psychiatrist to find out what you can do to both prevent and treat anxiety and panic-related symptoms. Having a treatment plan and sticking to it when an attack strikes can help you feel like you're in control. If you feel an anxiety or panic attack coming on, then try the following. Take slow, deep breaths. When you feel your breath quickening, focus your attention on each inhale and exhale. Fill your stomach with air as you inhale. Count down from 4 as you exhale. Repeat until your breathing slows. Recognize and accept what you're experiencing. If you've already experienced an anxiety or panic attack, you know that it can be incredibly frightening. Remind yourself that the symptoms will pass and you will be all right. Practice mindfulness. Mindfulness-based interventions are increasingly used to treat anxiety and panic disorders. Mindfulness is a technique that can help you ground your thoughts in the present. You can practice mindfulness by actively observing thoughts and sensations in a non-judgmental way and without reacting to them. You can also use relaxation techniques such as guided imagery, aromatherapy, and muscle relaxation. If you're experiencing symptoms of anxiety or a panic attack, try doing things that you find relaxing. Close your eyes, take a bath, or use lavender, which has relaxing effects. You can also change your lifestyle. The following lifestyle changes can help you prevent anxiety and panic attacks, as well as reduce the severity of the symptoms when an attack occurs. Reduce and manage sources of stress in your life. Learn how to identify and stop negative thoughts. Get regular, moderate exercise. Practice meditation or yoga. Eat a balanced diet. Join a support group for people with anxiety or panic attacks, and limit your consumption of alcohol, drugs, and caffeine. Speak to your doctor about other treatments for anxiety and panic attacks. Some common treatments include psychotherapy or medication, including antidepressants, anti-anxiety drugs, and benzodiazepines. Often your doctor will recommend a combination of treatments. You may also need to alter your treatment plan over time. Panic attacks and anxiety attacks aren't the same, though these terms are often used interchangeably. Only panic attacks are identified in the DSM-5. Anxiety and panic attacks have similar symptoms, causes, and risk factors. However, panic attacks tend to be more intense and are often accompanied by more severe physical symptoms. You should contact a doctor, psychologist, or psychiatrist if anxiety or panic-related symptoms are affecting your everyday life. If you'd like to contact me and speak in further about this anxiety or panic attacks, then please click on the link below. Okay, thanks. Bye-bye.